2 flushes.
a med and a syringe. That's all you're going to need for your IV push demo, because the IV's already in.
Do you have that out, or do we have to scavenge for it?
They'll be out.
Okay.
You'll have an order, and it'll tell you what med you're given. I usually stick with morphine, Lasix, or Phenergan, because you know what those are. You know, instead of giving you some weird random drug, it's going to take you 10 minutes to look up. I'm going to give you something you already kind of know. So you can make the decision of drawing the med up in the med room, labeling it and carrying it to the patient's room, or you can draw it up in the patient's room. I recommend drawing it up in the patient's room just to save you that whole, what do I do with the end of this syringe that's exposed? What do I do about labeling? I'm just going to go in the patient's room and do it. I need this to scan in the computer anyway. So for this patient, we're going to give Lasix. The order reads Lasix 40 milligrams IV push, BID. So I'm going to look at my vial and go, okay, I have Lasix, but it only has 20 milligrams per milliliter. How many milliliters do I need?
2.
I forget what
2. The order's for 40. I have 20, so I need 2. So I'm going to clean the top of my vial. $29.30. Let it dry. Now, sometimes you'll have a needleless connector where there's a little, you just push it in and then you twist your needle onto the top of it. Most facilities have gone needleless. We have not. So we're going to have syringe and needle. I'm just going to big old needle. 2 mLs of air. Two mLs of Lasix. Now, because I'm not going to need this needle because this is needleless, I'm going to go ahead and pull my syringe back to get it out of my needle, and then I'm just going to flip the safety. That way, I don't have to worry about sticking myself, but my needle's covered. So if you were going to go into the patient's room, if we were in the med room, you could take it like this. Just make sure it's labeled. Sorry, I have an air bubble in there I'm trying to get. Okay. All right. So in the patient's room, I'm going to assess my IV site first. Make sure it still looks good. There's no swelling, there's no bruising or anything like that. I want to flush it to make sure that it's actually going to work before I put my medication in. So I am going to disconnect the tape so that I can have some room. Clean the top, 29.30, let it dry. With your first flush, you want to aspirate. So open your clamp and pull the plunger back. Now, I'm not in this vein, obviously, so I got air. But I would want blood in here to make sure I'm still in the vein, it still works. So I'm going to flush it. Flush is nice and easy.
10 cc's, right? Or is it 5?
Facility policy will dictate 10 versus 5. If your patient doesn't have any kind of fluid volume issues, 10's not going to be a big deal. But if you've got like a heart failure patient or fluid restriction patient, you may only do 5. I'm only doing 5 because I know I'm not in the vessel and I know where this fluid is going. Okay. I'm going to take the needle off of my Lasix. Get rid of my air bubble. Okay. Now, here's where I need those administration instructions. I know I have 40 milligrams, which is 2 mLs. My order says no more than 20 milligrams every minute. How many minutes do I need?
2.
2. 2 milliliters, 2 minutes. 1 milliliter, 1 minute. Half a milliliter, half a minute. Quarter of a milliliter, quarter of a minute. So I'm going to watch the clock, either the clock on the wall or your own watch. And I'm going to push 1/4 of an ml. That only took me like 6 seconds. But again, that's why we break it down to those 15s, because that little tiny bit that I pushed in 6 seconds, I'm going to wait.
we write this down on paper, like the order?
Yeah, your order
Okay.
will be on paper.
So I can like do the math like
Mhm.
because
Yeah.
you keep saying numbers and I forget what the number was before.
Yeah, yours will be on paper. So I'm going to push 1/4 of an ml every 15 seconds. Usually after about the first 30 seconds, I tell you just to push the rest of it. Now I need my second flush. Now, here's the issue. This tubing's full of Lasix. So I need to start my flush at the same rate that I had my Lasix push going. So I'm going to push about the first 1/4 of an ml at that 15-second rate. Once I know I've cleared the Lasix from the tubing, I'm just going to go ahead and flush.
Is that with everything you're gonna,
Go the same rate.
yeah.
Mhm. Yeah, this doesn't even hold 1/4 of an ml. So usually it's hard to even tell that nurses do it because they just push like a teeny tiny bit and then they push the rest of it. Because once it's in the bloodstream, it's diluted. So before I take my syringe off,
Sorry.
I'm going to close the clamp so that I don't get the blood flowing backwards. I'm going to disconnect, retape my tubing, give my patient their medication instructions. You know, I just gave you Lasix. It's going to make you have to go to the bathroom. Might make it a little bit difficult for you to, you know, get up and use the bathroom on your own. You might be dizzy or lightheaded. So go ahead and hit your call light and wait for help. Clean everything up. Out of the room we go. That's
So
it.
you don't need gloves at all for that?
Nope. This or the piggyback, you don't need gloves at all. Because it's a completely closed system.
But if we put gloves on, that would not be wrong, right?
No.
Okay.